healthcare system in India. Before I begin, let me just ask a simple question. What do you think by health? How do you define health? Is it a state of being completely free from illness and injury, or there is something more to it? Think. Well, student, health we generally define a state when we are feeling mentally and physically well. Just not because you are not having any injury or you are not having any disease, that does not mean you are healthy. Health means when you are mentally at peace, when you are not having any low spirit, dullness, anxiety. At mental level, you feel confident with a free personality. Physically, when you are charged up, you do not feel any pale or physically tired or something of that sort. The ability to maintain that free will to do something in the most positive way possible without feeling tired, worrisome, etc. That is the situation of a health. We call that person a healthy person. Now students, other than talking about health, I would like to bring in front of you a little example. This example is of a person known as Hakim Sheikh. Why am I taking the example of Hakim Sheikh? Because the real story, which actually is linked to our Indian healthcare. So Hakim Sheikh got an accident done in 1992. He got a train accident done and he was very critical. He was taken to a hospital in Kolkata. It was a government hospital. He was taken to this government hospital, but he wasn't admitted into it. Then he was taken to another government hospital and he got no admission because it said that doctor is not available. He went to another hospital and it was said that it is full. You cannot, there is no separate bed for it. So basically, he did this 8 times. Now imagine a situation when a person has got injured and he is struggling for his life. That person has to move 8 times. For 14 hours, he was very critical. Right? And he was struggling with life. Why? Because government hospitals, which actually should provide you with the relief, as government is working for welfare in terms of health, they are providing us hospitals where the ilaj or the process of helping you is reasonable. It is manageable by a person. But that thing is not being given, or that right is denied to a person. In our constitution also, we have a right to a healthy living. We have a right to that, but we are unable to get it because the hospital is denied. Now, that is the real state of public health care. We call this public health care, a healthcare scheme where government has big initiatives or policies for the welfare of people. But it doesn't turn out well, as I gave you the example of Hakim Sheikh. Finally, he has to go to a private hospital where he was cured. That is called private healthcare. He has to visit a private healthcare to finally be cured, but lot of money was charged and it was difficult to pay that. Not everybody can take the expenditure of private hospitals. This is the difference between public and private healthcare. Private healthcare is the conception that you are treated very well, that there is fast appointment, you can directly visit, the environment is very nice, there is quick solution, there is a fast remedy, a lot of medicines are given, but you take rest and it's over. But with public healthcare, what is the notion, students? What is the belief? A belief which happened to Hakim Sheikh, that it will take hours to stand in a queue, then they will give you an appointment, then doctor will look very fast to you, will provide you with basic medicines. You are cured or not, again is a question. So this kind, and sometimes when you go to government hospitals, there are no beds, and then the person has no choice but go to the private hospital. This is the case, and we can take many examples like Hakim Sheikh. and explain that what is the difference between private and public hospital. Though India claims itself to have one of the largest hospital services, we are producing almost 15,000 doctors every year. But sometimes the doctors do not want to go to the rural areas, and those are the problems in healthcare which I am going to discuss now. Now, when we talk about the healthcare in terms of India, I have written a data which will help you understand what is the situation. It is said that around 1950, we had these many hospitals, 2,770. 1990 it increased to some 11,000 something. 2000 we increased this number. But still, the reality exists that in India, 5 lakh people die still because of tuberculosis, and 2 lakh people still die because of malaria. The number is not decreasing. Every year, that is the number of people dying. So what happened to these hospitals